patients right off the bat. Apologizing is definitely important. Asking them what questions they have is also very important. And the third is also important. I wish I could put these all as a tie. So what is going to be most important to me? I think asking the patient and family what questions they have about the error is going to be most important to me. I mean, apologizing is also pretty important, but I think in the grand scheme, identifying potential causes is going to trump that a little bit. So I'm going to put that as number 2, and then apologizing is number 3, although I'd definitely be sure to do that. You're shopping in a grocery store with one of your parents when they start to behave strangely. Your parent starts to get very anxious about someone else they saw in the store. They keep saying it'd be best to leave and come back at a later time. Become concerned and ask what the issue is. Tell your parent not to worry and that they're just imagining things. Suggest to your parent that you could confront the other person. Leave the store immediately with your parent. Comfort your parent, but continue shopping to complete your errand. I think I would definitely become concerned and ask what the issue is because I'd want to understand more about that. So I'm going to put that as number 1. I wouldn't tell them not to worry and that they're just imagining things because that just is a little condescending and they might be rightfully worried about something that you just don't really know what happened. So I'll put that as number 5. I'm not going to suggest that I confront the other person because who knows what the situation is in the background. They might have a really good reason to be nervous, so I'm not going to suggest that I go up to them because I don't think I could really solve that problem for them. I think I'll put number 2 as leaving the store because if my parent really feels that uncomfortable, like no grocery shopping errand is so important that it can't wait until later if they're really that uncomfortable. And so number 3 will just be to comfort them but continue shopping, I guess, if they feel comfortable with that. One of your best friends visits you during college. One evening during dinner, they begin to tell you that they're planning to drop out of school. They begin to list the factors they've weighed while making their decision and begin to cry. They say there are too many overwhelming obstacles and that they're not cut out for college. Offer a hug or a moment to let them reflect on the discussion because they're crying. Request they list the issues they've encountered and offer strategies you've used before to prioritize managing college life. Acknowledge that feeling overwhelmed is a common occurrence in college. Ask if your friend has sought support from school administrators or talked to anyone about it if sought support and or talked to anyone. Provide support for their decision and acknowledge that the decision was difficult. That's interesting. Well, my first thought was, interestingly, not to encourage the decision, but then I think for some people, college really isn't for everybody, and so I don't want to immediately antagonize them by thinking that. So I don't know if I'll put that last or not. All these are pretty good. You definitely would want to acknowledge that college is overwhelming for a lot of people. I think number 1 I'm going to do is see if they've sought support from school administrators or if they've talked to anyone else about it, because I would love to know if I'm the first person they've talked to about it, because that will kind of guide my discussion with them as to what the issues are and what to do next. I want to know if they've talked to anyone else. So I'm going to put that as number 1. Requesting a list of issues sounds like a little odd, but also kind of helpful. I might put that as 2 or 3. I wouldn't want them to focus on all the issues they've encountered, but I do like how you can offer strategies that you use because that might allow you to help them better. I think I'm just going to put acknowledging that feeling overwhelmed as number 2 because that's definitely something that I would do, and it kind of helps. I know I've been stressed in undergrad and here in pharmacy school, and it helps to know that other people are going through the similar situation. So I'll put number 3 as requesting the list of issues and then offering to help them that way. I'm going to put providing support for the decision as number 5 just because I would want to hear more about what went into the decision, if it's what they really want. And if it's truly what they want, then I'd support it. But as of this moment, I wouldn't dive right into that without investigating it a little more. So that leaves offering a hug as number 4. You are asked by a physician to speak with a patient's family about the upcoming chemotherapy treatment for their 8-year-old son. When you start talking about the negative side effects of the drug treatment, the patient's parent becomes visibly upset and asks you to stop talking about this. Tell the patient's parent that it's hospital policy to review all of the necessary information before beginning chemotherapy and you're required to finish. Tell the physician the family refused to complete the education and became upset. Conclude the session and document education has been complete. Request to schedule a different time to continue discussing the medication when the family would be more comfortable. Ask the parent about their concerns with the medication. Well, I want to keep the conversation going, so I'm going to put number 1 as asking them about their concerns because I think that could lead to a greater dialogue about what their true concerns are and why they would not like to continue the education, because it's pretty important for them to know everything that can happen. It's not really like ignoring it will cause any of the bad side effects not to occur, so I think that's pretty important. I definitely would not conclude and document that education has been complete because it's basically a lie. So I'm going to put that as number 5. I'm going to put number 4 as telling the parent that it's policy to finish. That's pretty unprofessional, I think just kind of brusque and rude. So that leaves a couple left. So second most appropriate, I don't know if it's scheduling a different time. I don't know if the family would ever be more comfortable, if they think they would be more comfortable at a different time. Or telling the physician the family refused to complete education. I think requesting to schedule a different time is more proactive, so I'm going to put that as number 2. And then number 3 is telling the physician. I'm not really sure if they'll be able to do anything about that, so I'll put that a little bit lower. One of your patients appears to be very depressed, which they believe has been precipitated by the recent loss of a loved one. You realize their loss parallels one of your own experiences and wonder how this might be used to develop rapport with your patient. Discuss your own loss and subsequent feelings. Acknowledge their understandable sadness from experiencing a personal loss. Change the subject as dwelling on it may make them more upset. Encourage the patient to discuss their feelings with a friend, family member, or religious leader. Recommend they speak more with their provider about counseling services. Several of these are good. The only one that stands out to me as not being the best is just changing the subject, as dwelling on it may make them more upset. I think you'll get a feel for that as you talk to them more, and you can always change the subject later, but I don't think changing it right away, that kind of like shuts off any channels for communication, so I'm going to put that as number 5. I don't know if I would jump into describing my own loss. I like the idea of connecting with a patient in that way. I don't think that would be the first thing that I would do, but I'm going to put it as number 2. I think there's another one that's probably more appropriate, but it's still pretty appropriate. These other 3 are pretty comparable. Like they're personal, but not as personal as diving in and describing my own experience. I think number 1, I would encourage and discuss their feelings with a friend or family member. And then if they say that they've tried or nobody really understands their situation, at that point is when I would feel more comfortable offering my own experiences after suggesting that they speak with someone a little more close to them. Then I'll put number 2 as acknowledging their sadness. I think that's really, or sorry, as number 3. I'm going to put that as number 3, as acknowledging their understandable sadness. I think that's important for patients to feel like they're heard, even if they don't think that you completely understand what they're going through. So even if I didn't tell her about my own experience, I think just acknowledging that and appreciating that emotion instead of ignoring it is important for the patient. So that leaves recommending they speak with their provider as number 4, which is important, but I think not as appropriate as some of the other choices. When you contact a pharmacy to verify a patient's medication history, the pharmacist complains the store is really busy and that the information is probably already in your system. The pharmacist asks you to call back later, but the doctor is requesting the information before they start any new medications. Tell the pharmacist patient care is a top priority and this is essential information that will only take a few minutes to share. File a complaint about the pharmacist to the store's manager. Tell the pharmacist you understand how they feel and how hectic your job can be at times. Apologize for the inconvenience and convince the pharmacist of the urgency of the situation. Ask the pharmacist if there is an alternative or easier way to facilitate getting the information. Let's see. So we're trying to get medication history and it's pretty busy. I'm not going to file a complaint. That will just make the pharmacist more upset and it really won't get us anywhere and it definitely won't get us the information that we need. So that's number 5. So the doctor wants to get this information before starting any medication. So it's pretty important. So I'm not going to say to just kind of ignore the request and just leave it be. Let's see. So I'm going to put number 4 as telling the pharmacist you understand how they feel and how hectic our job is. Like, I would tell them that, but I don't think that gets at the need of this information, because if the physician